Hi friends, welcome back to the Nurse YouTube channel. So today we are with our third part of the ICU series what we have started a couple of days back. So today is the third series and this series also include nearly 20 questions from different aspects of intensive care. So whoever didn't watch the old videos, the part 1 and part 2, I request everyone to go through those videos also because it will be very much helpful for you for your ICU interviews and upcoming nursing officer examinations, competitive examinations. So before going to the today's last series of ICU questions, I request everyone who are not subscribed yet, kindly subscribe our channel and support us. And kindly enable the bell icon also so that you will be notified whenever we are uploading new videos. Okay, so straight away we will move on to the today's question and answers with explanation regarding to the ICU, that is intensive care units. Okay, so we will move on to the questions directly. So today's first question. So the first question is, an autologous blood transfusion refers to. So first question is, an autologous blood transfusion refers to dash. So the options for you are, the first option, blood that has been screened. The second option, blood that is taken from the patient for their own transfusion. Option number C, blood that is taken from the patient's blood relative. And the final option, blood that is donated through the blood transfusion services. So what is autologous blood transfusion? So what is the answer? It's a direct question. So the answer is blood that is taken from the patient for their own transfusion. That means blood will be taken from patient itself before a particular procedure or whatever it is, and the same blood will be transfused to the patient whenever it is necessary. So that is known as the autologous transfusion. Then you have to understood what is allogenic transfusion. Okay, so what is allogenic transfusion? Allogenic transfusion is when a donor and a recipient are not the same person. Okay, so allogenic means the donor will be different from the recipient. Okay, and autologous transfusion means the donor and the recipient are the same person. That means the blood will be taken from the same person itself and the same blood will be transfused to the same patient. Okay, so this is the difference between allogenic and autologous transfusion. So that was the first question. So moving on to the second question. So the second question is, which among the following is a preferred anesthetic drug for performing procedures in ICU? So the question is, which among the following is a preferred anesthetic drug for performing procedures in ICU? So you know the procedures, the small procedures what are performing in ICUs. So which will be the drug, preferred anesthetic drug? That is the question. And the options are, the first one is diazepam. Option A is diazepam. Option B, propofol. Option C, ketamine. And the final option is thiopental. So the options are diazepam, propofol, ketamine and thiopental. So what is the answer? All these are anesthetic drugs. So the answer is propofol. Okay, propofol you might have seen, it's a white milky color injection. So we will see the answer in detail. So you know that propofol, it is a short-acting medication that results in a decreased level of consciousness and a lack of memory for events. Okay, so propofol, it is a short-acting. That is very, very important because it is a very much short-acting medication, and so if you are giving propofol also, patient will be out of the sedation or out of the anesthesia within a short period of time, and it will cause a decrease in the level of consciousness and a lack of memory of the events. Okay, for the events. So that's what we require for small procedures happening in the ICUs. Okay, and what are the uses? So its uses include the starting and maintenance of general anesthesia, sedation for the mechanically ventilated adults, and procedural sedation. So our question was, for the short procedures, which medicine was used? So the answer for this question is propofol. Okay. So moving on to the question number 3 in the ICU series part 3. So the question is, the cardiac output is normal or elevated in which type of shocks? Which type of shock? Cardiac output is normal or elevated in which type of shock? So the options are, the first option is the hypovolemic shock, second option is cardiogenic shock, third option is distributive shock, and the final option is obstructive shock. So the question is, the cardiac output will be normal or elevated in which among the following shocks? So what is the answer? So the answer is option number C, that is distributive shock. So we will see. So you know that in usually in other types of shock, the cardiac output will be very less. Cardiac output will be less and the patient will be in hypotension and all. Okay. So in the distributive shock, what is happening is it results from excessive vasodilation and the impaired distribution of blood flow. Okay. There will be excessive vasodilation and there will be impairment in the distribution of blood flow. So one example for the this distributive shock is the septic shock. Okay, the distributive shock is different from the other three categories of shock in that it occurs even though the output of the heart is at or above a normal level. So this was the question asked, that is the distributive shock. The difference between the distributive shock and the other types of shock is that the cardiac output in the distributive shock is normal or at above normal level. Okay, so the most common cause is sepsis, that is an infection leading to a type of distributive shock known as the septic shock. Okay, so the septic shock is the very well common example for the distributive shock in which the cardiac output will not be affected. Okay, so in the other options, if we have seen that hypovolemic shock. So what is a hypovolemic shock? Hypovolemic shock is an emergency condition in which severe blood or the other fluid loss makes the heart unable to push enough blood to the body. Okay, so because of the hypovolemia, shock will happen, that is hypovolemic shock. So the other one more was there, that is a cardiogenic shock. So what is a cardiogenic shock? So cardiogenic shock occurs when the heart is unable to supply enough blood to the vital organs of the body. So as I said, what will happen is there will be failure of the heart to pump enough nutrients to the body, and there will be fall in the blood pressure, and the organs may also start to fail. Okay, so that is happening in the cardiogenic shock. Okay, so here the heart is unable to supply enough blood to the vital organs. So that is the main cause. So one more option was there in our question, that is obstructive shock. So what is obstructive shock? Obstructive shock is one of the 4 types of the shock caused by a physical obstruction in the flow of the blood. Okay, so in obstructive shock, what is happening is, as the name indicates, there will be a physical obstruction in the flow of blood. So obstruction can occur at the level of the great vessels or in the heart itself. Okay, so wherever it is, whether it is the great vessels or whether it is in the heart, the final effect will be there will be reduced cardiac output, there will be hypotension, there will be reduced blood supply to the other vital organs, and finally the patient will move on to a fatal condition, that is a shock. Okay, so we have explained about the destructive shock, distributive shock, then obstructive shock, then hypovolemic shock and cardiogenic shock. In that all shocks are accompanied with reduced cardiac output and hypotension. Okay, so moving on to the next question. Which of the following plasma protein is involved in coagulation of blood? So the question is, which of the following plasma protein is involved in coagulation of blood? So the options are, the first option albumin, the second option is globulin, the third option is fibrinogen, and the final option is amylase. So which of the following plasma protein is involved in the coagulation of blood? So what is the answer? So it's a simple direct question. So the answer is fibrinogen. Okay, so you know the process that fibrinogen, it is a glycoprotein, and during the tissue injury, if it is converted by the thrombin to form fibrin and subsequently to the fibrin based blood clot. Okay, so fibrinogen, it is a glycoprotein which is involved in the blood clotting mechanism. So moving on to the next question. And before moving to the next question, we will see the other options. That is, we have seen that albumin and globulin. So what is albumin? Albumin, which helps keep the blood from leaking out of the blood vessels. Okay, it also helps move hormones, medicines, vitamins, and other important substances throughout the body. And albumin is made in the liver. Okay, so albumin is help in the transport of hormones, medicines, vitamins, and other important substances throughout the body, and it is not involved in the clotting process. And same like that, the another plasma protein, that is the globulin, which help fight infection and move nutrients throughout the body. Okay, and some of the globulins are made by the liver. Okay, so that's all regarding the question. And one more option was there in the end, that was the amylase. So what is the function of the amylase? Amylase main function is to hydrolyze the glycosidic bonds in the starch molecules and converting the complex carbohydrates to simple sugars. So that is the function of amylase. So in the options, albumin, globulin and amylase already we have explained, and the answer for our question was fibrinogen, which helps in the blood clotting process. Okay, so moving on to the next question. So the fifth question, which of the following nursing measures is inappropriate when providing oral hygiene for a stroke client? Okay, so in the neurological ICUs and all, many of the patients will be having, many of the patients admitted will be stroke patients, and it is a very important question. Which of the following nursing measures is inappropriate when providing oral hygiene for a stroke client? So here the options are, so the first option, placing the client on the back with a small pillow under the head. Second option, keeping portable suction equipment at bedside. The third option, opening the client's mouth with a padded tongue blade. And the final option, cleaning the client's mouth and teeth with a toothbrush. So among these options, which is inappropriate while providing oral care for a stroke client? So what is the answer? So the answer is placing the client on the back with a small pillow under the head. So what will be the reason why it is inappropriate? We will see in detail. So a helpless client should be positioned on the side, okay, not on the back. Why? There will be chances for aspiration and all and other related complications. So this lateral position helps the secretion, especially during oral care and all, escape from the throat and mouth, minimizing the risk for aspiration. So to prevent aspiration and other complications while providing the mouth care for a helpless client or a patient with stroke in the sideline position or the lateral position. Okay, so it may be necessary to suction. The other options we will see, we have, it may be necessary. Sometimes patient will not be able to spit out the saliva and the froth from the mouth, so a suction may be necessary for stroke patients, and so we have to keep a suction equipment at the bedside, and it is also a necessary measure. And we have seen another option, like we have to provide padded tongue blades. Yeah, padded tongue blades are safe to use. Have the patient sit upright, preferably on the chair when eating and drinking, and advanced diet as tolerated. Okay. So moving to the sixth question in our ICU series, the question is, what is the most therapeutic position for a client with pelvic inflammatory disease? So the patient with pelvic inflammatory disease should be provided which position, which is the most therapeutic position for a client with pelvic inflammatory disease? So the options are, first one is a supine position, second option is Sims position, third option is semi-Fowler's position, and the final option is lithotomy position. So what is the answer? Patients with pelvic inflammatory disease. So the answer is semi-Fowler's position. Okay, semi-Fowler's position. Why semi-Fowler's position? So the patient should be placed in a semi-Fowler's position to facilitate drainage of the infection, because there will be drainage from the infection side, and this intervention may help relieve pain also, and in addition to preventing abscess formation in the abdomen. Okay, so the purpose of providing semi-Fowler's position for a patient with pelvic inflammatory disease is it will facilitate the drainage, and it will help in relieving the pain, and it will prevent the formation of abscess in the abdomen. Okay, so that's why we are providing semi-Fowler's position for patients with pelvic inflammatory disease. Okay, so moving on to the seventh question. The question is, the most common sites for pressure ulcers in intensive care unit patients are. So this is also a common and easy question. So the question is, the most common sites for the pressure ulcers in intensive care unit patients are. So the options are, the first one is ears and knees, the second option is sacrum and heels, the third option is elbows and hips, and the final option is shoulder blades and wrist. So among these, which is the most common site for development of pressure ulcer in intensive care unit? That's a question for you. So what is the answer? So the answer is sacrum and heels. I think there is no need for further explanation for this question. And what all options they have given here are pressure points. Okay, all areas are prone for the development of pressure ulcers in each position. If the patient is positioned on the sideline position, some areas are there. If the patient is positioned in the supine position for a longer period of time, there also some prominent areas are there for the development of bed sore. So in total, the most common site for the pressure ulcer development is sacrum and heels. Okay, so moving on to the next question, question number 8, and the question is, what is the optimum temperature to store blood right after collecting it? So what is the optimum temperature to store the blood after collecting it? So the options are option number A 25 degrees Celsius, option number B 22 degrees Celsius, option number C 20 degrees Celsius, and option number D 15 degrees Celsius. Okay, so what is the answer? 25, 22, 20, 15. So what is the answer? So the answer is 22 degrees Celsius. So we will see the explanation for this question. So once the blood is collected, it is stored at 22 degrees Celsius. Okay, so at this temperature, the blood proteins are safe from degeneration, the cells function properly, and the presence of anticoagulants ensures that the blood is not clotting. Okay, so this is the reason why we have to keep the collected blood at 22 degrees Celsius. So it will prevent at this temperature the blood proteins will be safe from degeneration and the cell functions properly, and the presence of anticoagulants ensures that the blood is not getting clotted. Okay, so this is the explanation for that. So moving on to the next question, question number 9, and the question is, cessation of breathing for a short period is called dash. Cessation of breathing for a short period is called dash. And the options are, the first option is dyspnea, the second option is orthopnea, the third option is apnea, and the final option is bradypnea. So what is the term for the cessation of breathing for a short period? So what is the answer? It's a simple question. Answer is apnea. So we will see each option in detail. So you know that dyspnea, what is a dyspnea? Dyspnea is the difficult or labored breathing. The term for the difficult or the labored breathing is dyspnea. And the next option was the orthopnea. What is orthopnea? Orthopnea is a sensation of breathlessness in the lying flat position relieved by sitting or standing. Okay, so there will be breathlessness if the patient is lying in the flat position, and the breathlessness will get relieved by sitting or standing. That is orthopnea. Then the next option was bradypnea. So what is a bradypnea? Bradypnea is a respiratory rate that is lower than normal for the age. So there is a normal respiratory rate for a particular age, and bradypnea is a respiratory rate that is lower than normal for the age. So the next, just for your information, what is tachypnea? Tachypnea is a respiratory rate that is greater than the normal for age. And one more information for you, what is hyperapnea? So hyperapnea is increased volume with or without an increased rate of breathing. Okay, so there will not be so the rate is not taken into consideration in hyperapnea. In hyperapnea, what will be monitored is there will be increase in the volume with or without an increase in the rate of breathing. So that is hyperapnea. Okay, so next question is from the blood transfusion. So we will move on to the next question in our ICU series. The question is, midway through a blood transfusion, a patient complains of severe back pain. So what should the nurse do? So I think the question is clear for you. Midway through the blood transfusion, the patient was complaining of severe back pain. So what should be the priority action by the nurse? Okay, so your options are, the first option is reassure the patient. The second option is stop the transfusion and take the vital signs. The third option is speed up the transfusion, and the final option is administer analgesics or analgesia. So what will be the priority action by a nurse if a patient is complaining of severe back pain during the process of blood transfusion? So what is the answer? So the answer is stop the transfusion and take vital signs. Okay, so the option is stop the transfusion and take vital signs. Why? So this severe back pain is actually it is a sign of a disease, a sign of the side effect of blood transfusion, that is acute immune hemolytic reaction. Okay, so what is acute immune hemolytic reaction? We will see what is acute immune hemolytic reaction. So the attack triggers a release of a substance that damages the kidneys. Okay, so this is often the case when the donor blood is not a proper match with the patient's blood type. So the symptoms include nausea, fever, chills, chest and lower back pain and dark urine. Okay, so if the patient develops acute immune hemolytic reaction, these symptoms will be evident. Okay, so acute hemolytic reactions can happen if there is a if the blood is not matching, and the symptoms include nausea, fever, chills, chest and lower back pain and dark urine, because it will damage the kidneys. Okay, because of that we are getting lower back pain, then dark urine, etc. Okay, so this need to be taken into consideration as a serious matter, and we have to stop the infusion, the blood transfusion that moment itself, and we have to check the vitals of the patient, and we have to notify the physician immediately. Okay, that is the duty of nurse while providing blood transfusion if the patient develops symptoms like this. Okay, so in the question they have asked for the symptom lower back pain. If something like a dark urine or fever, chills, whatever it is, if the symptoms are there, then immediately the transfusion should be stopped and we have to check the vitals of the patient. Okay, so moving on to the next question. So the 11th question is, in hypovolemic shock the decreased cardiac output is due to dash. So what is the reason for decreased cardiac output in hypovolemic shock? So it's an easy question. So the options are, the first option is inadequate blood or plasma volume. Then the second option is reduced venous return. The third option is failure of myocardial pump. And the final option is both A and B. So what is the answer? What is the reason for reduced cardiac output in hypovolemic shock? Okay, this should be very clear which type of shock, that is hypovolemic shock. So what is the answer? So obviously the answer is option number D, that is both A and B, that is inadequate blood plasma volume and reduced venous return. Okay, so this we will explain now, but the option C, you can see there is a failure of myocardial pump. This failure of myocardial pump will happen in which type of shock? That is a cardiogenic shock. Okay, so here the answer is inadequate blood plasma volume, and as a result there will be reduced venous return to the right atrium, that will result in the hypovolemic shock. Okay, so we will see the loss of blood associated with the hypovolemic shock causes a reduction in the venous volume or the venous return, which in turn diminishes the preload, stroke volume and finally the cardiac output. Okay, so this is the mechanism. The loss of blood associated with the hypovolemic shock causes a reduction in the venous volume. So there will be venous volume will be reduced, so that will affect the preload, stroke volume and finally the cardiac output. Okay, I think it is clear for you now. So we will move on to the next question. It's a very important question. The question is muscle relaxant of choice in emergency department for endotracheal intubation. So which is the drug of choice as a muscle relaxant during endotracheal intubation? That is the question for you. And the options are, the first option is vecuronium, the second option is succinylcholine, the third option is racuronium, and the final option is atracurium. Okay, options are vecuronium, succinylcholine, rocuronium and atracurium. So which is the muscle relaxant of choice during endotracheal intubation in the emergency department? So what is the answer? So the answer is succinylcholine. Okay, so we know that it is a very popular drug in the emergency department due to its rapid onset. Okay, the action is very rapid and brief duration of action. Okay, so the action also is very rapid, and the duration of action also is very brief. So in the emergency department, this is a drug of choice as a muscle relaxant for endotracheal intubation. Okay. So moving on to the next question, and this is related to the ortho ICU, and the question is, bone spurs are also called dash. Have you heard about this term, bone spurs? So bone spurs are also called dash. and which disease is associated with this bone spurs and all, that we will be explaining in this question. So the options for this question are, first one is osteomyelitis, the option number B is osteopenia, option number C is osteoporosis, and the final option is osteophytes. So what is the answer? Question was, the bone spurs are also called as dash. Osteomyelitis, osteopenia, osteoporosis, osteophytes. So what is the answer? The answer is osteophytes. Now we will see each term in brief. So first of all, what is bone spur? That we have to see. So in a condition called as the osteoarthritis, what will happen is the cartilages will start to deteriorate. Okay, so as the cartilage deteriorates in the osteoarthritis, bone spurs can develop and grow near the end of the bone in the affected joint, and it is called as the osteophytes. Okay, so as a result of the deterioration of cartilages, these spurs, some bone spurs can be developed and it can grow at the end of the bone in the affected joint of patients with osteoarthritis, and these extra growth of the bone in the affected joint is called as the osteophytes or the bone spurs. Okay, so the answer for our question is osteophytes. Now we will see the other options. So the first option was osteomyelitis. So what is osteomyelitis? Osteomyelitis is an infection. So this is an infection in the bone. So infections can reach a bone. How it can reach the bone? It can reach by traveling through the bloodstream or spreading from the nearby tissue. Okay, so this is in brief about osteomyelitis. So it is an infection in the bone. So the next option was osteopenia. So what is osteopenia? Osteopenia is a bone loss. Okay, so penia, that is bone loss in which the bone mass density is below normal. Okay, so osteopenia is the BMD, bone mass density is below normal, and there are chances for easy fracture, brittle bone, etc. So that is osteopenia. So we will move on to the next option, that is osteoporosis. So what is osteoporosis? Osteoporosis is a condition in which bones become weak and brittle. Okay, this is also another disease condition, osteoporosis. I am not going in detail, just you please understand the terms. Okay, osteoporosis, osteopenia, osteophytes, and osteomyelitis. Clear? So we have learned about the 4 terms through a single question. Okay, so moving on to the next question, 14th question. Which of the following symptoms is most characteristics of a client with a cancer of lung? Okay, so this is related to the respiratory system and cancer of CA lung. So which of the following symptoms is most characteristics of a client with a cancer of the lung? So which one are the options? Option number A, air hunger. Option number B, exertional dyspnea. Option number C, cough with night sweats. And option number D, persistent changing cough. So which is the most characteristic symptom of a client with CA lung? What is the answer? So this question also is very important. So the answer is persistent changing cough. Okay, persistent changing cough is the most characteristics of a patient with CA lung. Okay, so we will see that in detail. So the most common symptoms of a lung cancer are a cough that does not go away or gets worse. Okay, so definitely CA lung patient will be having some or the other type of cough. Okay, sometimes it will be a nagging cough, sometimes it will be like we will have some kitch over the throat. No, sometimes it will be very less, sometimes very severe cough. So the cough will be there and that does not go away or get worse, and people can have very chesty coughs. Okay, so sometimes severe cough will be there, or they can have very subtle tickly coughs. Okay, like our kitch and all, like a constant clearing of our throat. Okay, so this is the most characteristics, the most evident characteristics of a patient suffering from CA lung. Okay, so I think it is clear for you. Now we will move on to the 15th question. So this is related to an instrument. So the question is, colposcopy is an instrument used to dash. So the question is direct question, what is the instrument called colposcopy? What this colposcopy is used for? That is a question, and the options are option number A, it's an instrument to visualize the fallopian tubes. So it remove the genital warts. The third option is it is an instrument used to visualize the surface of the cervix, and the final option is it visualize the uterus. So what is the answer? Colposcopy. So obviously you know the answer. The answer is visualize the surface of the cervix, to visualizing the surface of the cervix. So Colposcopy is a medical diagnostic procedure to visually examine the cervix as well as the vagina and vulva using a colposcope. Okay, colposcopy, it is a medical diagnostic procedure to visually examine the cervix as well as the vagina and vulva using a colposcope. And what is the goal of colposcopy is to prevent the cervical cancer by detecting and treating pre-cancerous lesions early. Okay, so it's an instrument to detect whether any changes are there in the cervix or in the vagina or in the vulva, and is there any pre-cancerous lesions are present or not. That can be detected with the help of colposcopy, and that is the main goal of colposcopy. Okay, so that question is over. Now next we'll move on to the 16th question. The rule of nines refers to. Okay, so it's a little confusing question, so be careful. So what is the rule of nines refers to? So the options are the depth of a burn. Option number A, the depth of a burn. Option number B, burn percentage in adults. Option number C, burn percentage in children. And option number D, burn percentage in both adults and children. So what is the answer? It's a little confusing question. So what is the answer? Rule of 9 refers to rule of 9. So you know that it is definitely associated with the burns. So whether it is for the adult or whether it is for the children or whether it is for both adult and the children, that is a matter of confusion here. So here the answer is burn percentage in adults, not for the children. So we will see in brief about the burns calculation in the adult. You see, so here this is the burns calculation in the adult, and we can see that the head and the trunk head and the trunk contributes about the 9% of the total body surface area, and the front and the back, including the chest and the posterior back, we can see they have given 18%, 9 each in the both area. So 18% in the front and 18% in the back, and each side they have given 4.5% each side, and it will contribute about the 9%. And both legs, lower limbs, including the back side and the front side, it is calculated as 18%. Okay, 9% in each side, and the perineum area is considered to be 1%. So the burns calculation, the adult can be done with the help of rule of 9, and it is divided in this way. Okay, so in total it will be 100%. Okay, perineum also is considered as 1% in adult. So moving on to the children, in the pediatric population, the burn calculation is a little different. So the head and neck, anterior and posterior, it is calculated as 18%, and same like the adults, the front and back, it is calculated as 18% each, and each limb is calculated as 9% each, and the lower limbs are calculated as 14% each, and there is no separate calculation for the perineal area. Okay, so these are the difference between the rule of 9, that burn percentage calculation in adult and pediatrics. Okay, so in total it will be 100%. Okay, so I think it is clear for you. So burn calculation in adult is different from burn calculation in pediatric population. Okay, so rule of 9 is primarily aims at the burns percentage calculation for adult, not for the children. Okay, so moving on to the next important question. Amobarbital and thiopental are examples of. So a question from pharmacology. Amobarbital and thiopental are examples of dash. So the question is regarding the class of drug. So the options are, the first one is benzo. Option number A is benzodiazepines. Option number B is barbiturates. Option number C, muscle relaxants, and option number D, analgesics. So amobarbital and thiopental belongs to which class of drugs? Benzodiazepines, barbiturates, muscle relaxants, analgesics. So what is the answer? So these are barbiturates. Okay, amobarbital and thiopental are examples of barbiturates, and you know that barbiturates are ultra short acting and are used to induce and maintain anesthesia. Okay, so they are ultra short acting anesthetic agents which are used to induce and maintain anesthesia. However, though they produce unconsciousness, they provide no analgesia. Okay, so the important thing is they will not provide pain relief, but it will produce unconsciousness and must be used with other agents. Okay, so these barbiturates should be used with other agents for pain relief and all, but this is a ultra short acting drug, anesthetic drug, which can induce and maintain anesthesia. That means it will create a state of unconsciousness, but it doesn't provide analgesia. Okay, so that's a peculiarity of barbiturates. Okay, Amobarbital and Thiopental. Okay, so next question, the 18th question, it is really related to the bandaging techniques. So the question is the ideal roller bandage application for body parts where the thickness varies, such as over the forearm is. Okay, so the question should be very careful, read very carefully. The ideal roller bandage application for body parts where the thickness varies. Okay, so the thickness will be different in one part to the other part, for example in the forearm. So which is the ideal roller bandage application? That is the question for you, and the options are: the first one is simple spiral, then the second option is figure of 8, third option is reverse spiral, and the final option is divergent spica. So what is the answer? Simple spiral, figure of 8, reverse spiral, divergent spica. Question is regarding the part where the thickness is varying, which bandage application is more suitable. So what is the answer? So here the answer is reverse spiral. So we will see each one in brief. So first of all, what is a reverse spiral bandage? So the reverse spiral bandage is a spiral bandage where the bandage is folded back on itself by 180 degree and after 180 degree after each turn. Okay, so this V-shaped fold allows the bandage to fit to the tapered shape of the body part all the way along. So the question was related to the forearm, like the thickness will be, see in the forearm the thickness will be varying. In the towards the elbow side we can see the thickness will be more, and towards the wrist side the thickness will be less. So in such areas the spiral bandage is more appropriate because this bandage is folded back on itself by 180 degree and after each turn. So, and it is a V-shaped fold which allows the bandage to fit to the tapered shape of the body all the way along. So we will see a picture of a reverse spiral bandage. So this is the picture of the reverse spiral bandage, and you can see folds like V-shaped folds can be seen in this. Okay, so this is suitable for the forearm, then in the legs and all we can use this. Okay, so we will see the other options. We have seen that what is a simple spiral. So the answer for our question was the reverse spiral. So we will see what is a simple spiral. See, simple spiral means bandage is used for the application in uniform thickness areas, part like a finger, wrist, etc. Okay, if you want to put the bandage up to this point, okay, so here it is uniform. Then like fingers means it will be uniform. So in the uniform areas we can use simple spiral. So I think you understood the difference between simple spiral and reverse spiral. So we will move on to the next option, that is the figure of 8. So what is the figure of 8? Figure of 8 is used for joints joints like elbow and knee, which is made by forming two loops or oblique turns over a joint. Okay, so this is the figure of 8 manner. Okay, figure of 8 is used for the joints like elbow and knee, which is made by forming two loops or oblique turns over a joint. Okay, so for joints figure of 8 is the best application. Okay, so what is a divergent spica? That was the last option. So divergent spica is started with circular turns above and below the knee joint or the joints, and the turns are gradually bowed towards the center, completely covering the knee. Okay, so you can see here the folds will be starting, the circular turns will be starting from above and below. In the picture you can see from above and below, from both sides it will start, and in the center it will come and join. Okay, it can be applied over especially over the knee joints. Okay, so this is divergent spica and it is different from figure of 8. Okay, so through this question you have learned about what is the reverse bandaging, what is the spiral bandaging, reverse spiral bandaging, divergent spica and figure of 8. Okay, so moving on to the next question, 19, the second last question in our ICU series. So the question is a simple and cost-effective method for reducing the risk of hypostatic pneumonia in a bedridden patient. So the question is very clear. A simple and cost-effective method for reducing the risk of hypostatic pneumonia in a bedridden patient. Okay, so what is the step we have to take to prevent hypostatic pneumonia in a bedridden patient? So the options are: the first one is the use of antibiotics. Option number A, antibiotics. Option number B, nebulization. Option number C, frequent change of positions, and the final option is humidified oxygen, providing humidified oxygen. So among these methods, which is the best method to prevent hypostatic pneumonia in a bedridden patient? That's the question. So what is the answer? So the answer is frequent change of positions. Okay, so we will see how the frequent change of position will prevent the development of hypostatic pneumonia. So pulmonary congestions due to the stagnation of blood in the dependent portions of the lungs in older persons or in those who are ill and lie in the same position for long periods is the reason for hypostatic pneumonia. So what will be the reason for the hypostatic pneumonia? Because there will be pulmonary congestion will be there, which can be due to the stagnation of blood. Okay, so if the patient is kept in a dependent position for a long time, there will be stagnation of blood in the lungs, especially in the older persons and the patients who are critically ill or who all are lying down in the same position for a longer period of time. Okay, so this is the reason for the hypostatic pneumonia. So to prevent that, what we have to do, we have to change the position very frequently so that the stagnation in the lung will not happen and we can prevent hypostatic pneumonia. Okay, so the answer for our question is changing the position frequently. Okay. So moving on to the last question in our ICU series, that is the 20th question. It's an important question especially in the pediatric ICUs. Vacuum pressure used for suctioning in infants is. So it's a direct question but very important. Vacuum pressure used for suctioning in infants is. So your options are option number A 40 to 60 millimeter mercury, option number B 90 to 130 millimeter mercury, option number C 60 to 100 millimeter of mercury, and the final option number D 130 to 140 millimeter mercury. So vacuum pressure used for suctioning in infant, that is the question. What is the answer? So the answer is 60 to 100 millimeter of mercury. So answer is 60 to 100 millimeter of mercury is the vacuum pressure that we have to use for suctioning in infants. Okay. So then what will be for the adults? So we will see. So safe ranges for the neonatal suctioning depending on the size of the infants and are generally considered to be between 60 to 100 millimeter of mercury. Okay. So 60 to 100 is the acceptable or generally considerable suctioning pressure for neonates. Okay, so suction pressure should be kept at least less than 200 millimeter of mercury in adults. So in adults it is less than 200 millimeter of mercury, and for neonates it is 60 to 100 millimeter of mercury. So with that we have come to the end of our series. So through the ICU series, through three parts, we have explained about nearly 50 questions. Okay, 15 questions, 50 questions, 15 questions in the first part, 15 questions in the second part, and nearly 20 questions in the last part. So these 50 questions which are taken from different parts of intensive care is very, very important, and I think you are benefited out of these 3 sessions of videos. And I repeat, whoever didn't watch the previous parts, kindly go through those videos and make use of it. Okay, so thank you for watching the video. So see you soon with another set of questions and another set of video. So till that time, stay tuned. Once again, thank you for watching.